Welcome back to Blocking the Flame, Anakinra and COVID. I'm your host, Gaganasri. My work often finds me somewhere between complex biological systems and the language of code, where biology meets computation. Today, we're talking about something that might seem like a matter of delivery, but in truth, it's a matter of life. Dosing strategies for Anakinra and COVID-19. Like adjusting the nozzle of a fire hose, the method and the timing of administration can determine whether we dose the cytokine storm or let it rage on. Joining me today is someone whose fascination with immunology stems from the very roots of human biology. Welcome, Aseema. So happy to have you here.
Thank you so much, Gaganasri. I'm thrilled to be part of this discussion. And Anakinra's dosing, as we know, isn't just a pharmacological decision, it's a clinical chess move that can dramatically influence patient outcomes in COVID 19.
Well said. To kick things off, let's get into the fundamentals. How is Anakinra usually administered in COVID-19 patients? And what's the difference between giving it via IV bolus versus subcutaneous injection?
Okay, that's a great starting point. So, Anakinra can be administered in two primary ways, that is, IV bolus, which is essentially a swift and powerful intervention, I must say. It delivers the drug directly into the bloodstream, which is ideal for acute high inflammatory scenarios like the cytokine storm in COVID 19. This rapid action is often critical in preventing severe complications like ARDS or even multi organ failure. Subcutaneous injections, on the other hand, offer a slower, steadier absorption. While this method is common in chronic inflammatory diseases like rheumatoid arthritis, it's been adapted for COVID 19 as well, especially for patients stable enough for outpatient care or extended treatment regimens. So the distinction is about speed and intent. IV is your emergency brake, subcutaneous is your cruise control.
I love that analogy. Emergency brake versus cruise control. Now, when we are talking about COVID-19 specifically, do these patients generally need a more aggressive dosing schedule compared to those with chronic conditions?
Yes, they often do. COVID 19, particularly in its severe form, unfolds like a biochemical wildfire fueled by uncontrolled cytokines. In such cases, higher or more frequent doses of anakinra might be necessary to regain immunological balance quickly. In contrast, conditions where inflammation is chronic but stable, COVID 19 demands quick suppression. So you may see initial high dose IV bolus regimens followed by daily subcutaneous injections once the patient stabilizes. But, and this is important, such aggressive dosing comes with a need for tight clinical oversight. We are walking a tightrope between calming the storm and suppressing immunity too much.
That's a powerful image, like walking the immunological tightrope. Let's zoom in on timing now. When should clinicians ideally administer anakinra during the disease course?
Well, timing is absolutely critical here. Think of the cytokine storm like a dam that is about to burst. You want to reinforce the dam before the floodwaters can break through. And studies suggest that early intervention, ideally at the onset of hyperinflammation, yields the best of outcomes. That's when IV bolus administration is often favored. And once the storm is under control, subcutaneous injections can take over to maintain homeostasis. But if we wait too long, say once irreversible lung damage has occurred, anakinra might not provide the same benefit. And if we intervene too early, we risk blunting necessary immune responses. So it's a delicate dance there.
So we are aiming to tune the orchestra before the crescendo hits, not after instruments are broken. Are there clinical studies that support this stage dosing strategy?
Absolutely. So, multiple trials have explored high dose IV anakinra in the early inflammatory stage, followed by maintenance subcutaneous doses. The data is really promising there. Patients receiving this approach often show reduced mortality and shorter ICU stays as well. There's also a trend toward combination therapy, as we have discussed, where anakinra is paired with corticosteroids or agents like tocilizumab. These combinations aim to synergize immunosuppressive effects while minimizing toxicity from any single drug. Still, dosing protocols remain fluid. We need larger stratified studies that account for comorbidities, viral load, and patient immune status to develop precision guided dosing.
Precision medicine lens is so crucial, especially when managing a disease as heterogeneous as COVID-19. So before we wrap up, how do clinicians decide between IV bolus and subcutaneous methods for individual patients?
It boils down to three factors basically, that is, the disease severity, patient stability, and resource availability. Critically ill patient, especially those on ventilators, typically need IV bolus for rapid cytokine suppression. But if the patient is stable, subcutaneous injection is more feasible and less resource intensive as well. In some settings, IV setups may not be sustainable long term, so subcutaneous dosing offers practical flexibility, especially in outpatient or rural scenarios. Ultimately, clinicians have to make dynamic case by case decisions. And personalized care guided by biomarker levels like IL-1 and CRP is the future of immunomodulation in COVID-19.
Beautifully put, Asima. What I'm hearing is that Anakinra is not a one-size-fits-all therapy. It's a responsive tool in the hands of thoughtful clinicians.
Mhm.
Thank you for sharing your nuanced insights today. As someone grounded in systems biology and bioinformatics, I deeply appreciate how the immune system can be viewed like a feedback control network and how interventions like Anakinra must be carefully tuned in both time and dose.
Thank you so much, Gaganasri. I really enjoyed this conversation. And as we know, immunology is intricate, and the gut-brain axis that I'm passionate about also speaks how interconnected these systems are. So, Anakinra is one part of a much larger immunological puzzle, and it's really exciting to see how research continues to fill in the gaps.
And with that, we wrap another episode of Blocking the Flame. In our next discussion, we'll dive into real world case reports where we'll explore how Anakinra is working outside the carefully controlled lab environment. Whether you'll be tuning in from a clinic, a lab, or just your couch, stay curious, stay safe, and we'll see you next time.